A very good afternoon to all of you. On behalf of the CGIAR Science Program on Better Diets and Nutrition, I welcome all of you here and all our participants who are joining us virtually. My name is Isha Saraswat. I am the Interim Communication Lead for the Better Diets and Nutrition Science Program, and I'll be your host for the next 2 hours. Initially in our program, we had opening remarks by our chief scientist, Sandra, but I think she's not in the room. So I'll just continue with the program and we'll hear from her whenever she joins. So first, let me quickly take you to the 2 hours and how we are planning to spend the 2 hours. Yeah, thank you. So as you can see, I can't see it here, but that's fine. As you can see, we have a very interactive 2 hours. We are starting with an overview of the Better Diets and Nutrition program. Then we will go into a tweaked World Cafe model, not exactly a World Cafe model, but a tweaked World Cafe model, where you will listen from the 6 areas of work under BDN. After that, we will have a panel discussion where we have a diverse stakeholders from a country national level partner to a global donor. And after that, we will again request you to share your insights again through an interactive measure. And then that's how we'll end the 2 hours. I see Sandra is here, so yeah. So to start the session, I would like to call our CGIAR chief scientist, Dr. Sandra Milach, for her opening remarks.
Apologies that I got a little bit late. I was in another bilateral. It's been a very intense week, I can tell you, but a very productive one. Very, very much excited to be here. So I'm not going to be very, very long into this introduction. I think we are here to discuss a very important topic that is very aligned to some of the very big problems that we are trying to solve together. And I think and if you were yesterday and listened to my talk, I said, we need more food, but we also need to be able to balance the plate. We need better nutrition, not only more calories. Of course, we need more calories as well, but with also the balance of the nutrition. And I think there are many ways to achieve that, many pathways. And today we are really focusing one specific one, which is the biofortified foods. And I think breathing also is an important, Breathing for Tomorrow program is an important part of it, but there is also the nutrition is an important part of it. And I think within the portfolio, I think there is a lot of linkage that can support this problem that we're trying to solve together. So I'm really looking forward to what we're going to do today. Yeah, I'll be here participating and probably intervening with questions or thoughts during this. Thank you so much.
Can we have a round of applause for Sandra's encouraging words? The objective of today's session is to do a deep dive into the contents of the Better Diets and Nutrition program. We also want to gather your insights on how to make the program more sharper and how to ensure that the BDN, the Better Diets and Nutrition program, is contributing to all the other 4 impact areas of the CGIAR. So to now give us an overview of the Better Diets and Nutrition program, I would like to call upon Dr. Inge Brouwer, who's a senior research fellow and an interim director for the Better Diets and Nutrition program. Over to you, Inge. To point towards there.
Okay. And click. Thanks a lot, Esha, for introducing me, and I will give you an overview of Better Diets and Nutrition. Also on behalf of my 2 interim co-directors who are seated there, Matti Demont and Namakulu Kovic. Maybe you can stand up, then they can see you, who you are. So welcome to this session. I will explain more details about Better Diets and Nutrition. As said already, let me try whether it works. Oh, this one. So Better Diets and Nutrition is actually the only science program within the CGIAR portfolio that uniquely focuses on improving healthy diets for nutrition as an important outcome of food system transformation, focusing actually on what people in low and middle income countries have on their plates and what should be done to improve the composition of the plates of these people. So to ensure then better nutrition and health. So based on the global initiatives like the UN Food System Summit and the follow-up meetings that are actually accelerating food system transformation, having healthy diets is one of the important outcomes of this food system transformation. And also regional efforts like the CADEP, who is indicating or embedding also the importance of having healthy diets for the population in Africa. These regional and global initiatives are giving, provides excellent possibilities to lever the experience and knowledge and evidence that we have provided in the last years about better diets and nutrition within the CGIAR in our programs, Agriculture for Health and Nutrition, and also Shift and Fresh and Rethinking Food Markets. So the program goal is to seize opportunities to deliver evidence, insight, solutions, and decision-making tools to substantially contribute to making sustainable, healthy diets available, affordable, accessible, desirable, and give people agency to choose the food that they would like to consume. So to deliver this also equitably impact on nutrition, livelihoods, and the environment. So if you think about the impacts that we are focusing on, the primary impact area that BDN is working on is on nutrition, health, and food security. By working on nutrition, health, and food security, we do recognize that we need some prerequisites that need to be fulfilled to be or to have the most highest or maximize our impact on health. That is, of course, poverty, so reducing poverty, gender empowerment, as well as biodiversity are important underlying prerequisites that is needed to improve diets and nutrition. And we do also recognize that working on improving diets will also be looking for synergies and collaboration with those that improve environmental health and also adapt and mitigate to climate change. But we also do realize that there could be important trade-offs that we should discuss in our attempts to improve diets for populations. Now, why a focus on diets? Yeah, and we know all these alarming figures. Yeah, that women and children are affected by undernutrition and that these figures improve, but very slowly, and some remain stubbornly high. And we also know that billions of people are suffering from overnutrition and related diet-related non-communicable diseases nowadays. And poor quality diets are actually the leading cause of human capital in the world. And from the emerging evidence we build up from CGIAR research, we know that it's not only healthy diets that is needed to improve nutrition. And we need to link our knowledge about how to improve healthy diets also to other projects related to social safety nets, or projects on nutrition-sensitive agriculture, or projects that are improving water, hygiene, and sanitation to ensure that a healthy diet is consumed and that this will lead to a better nutrition and health status. And by doing so, if we are successful, we can save 1 in 5 lives by improving diets. So in the nutrition science, we have gone through different successions of paradigms. And the previous paradigms were actually not well suited to tackle the complex dynamics of changing diets and related nutrition and health problems. We went, for example, through a paradigm of protein deficiency. So we learned that focusing on only one single nutrient will not help to improve diets and malnutrition. We also went through planning processes at national level and at community level. But we also discovered that that only did not work to improve malnutrition. We moved to reducing nutrient deficiencies. But also there, we were not able to solve all the problems because nutrition issues nowadays are no longer limited to sufficient calories, insufficient kilocalories, or no longer only related to child's undernutrition like stunting and wasting or micronutrient deficiencies happening only in rural areas, but are now combined with a rapidly rising problem of overweight and obesity, both in urban and in rural settings, affecting whole populations, so not only women and children, through unhealthy diets. And the world continues to face more serious and related challenges related to environmental sustainability or climate or conflicts and livelihoods. And to address these together, we must comprehend the underlying processes and identify opportunities to systemic change, to eradicate hunger, to foster inclusive and healthier food systems, and protect our planet's health. And achieving this forces us to use and adopt a food system approach. And that's also what we will do in Better Diets and Nutrition. So we are inspired by the high-level panel of experts framework, and you see it on the slides, that is focusing on the components of food systems and especially the relationship between components and the trade-offs and synergies of working on different components together. So we are actually pledging for reverse thinking. So not starting with production, but actually starting with a diet. And it proves to be successful to identify out-of-the-box solutions, as it relies on a backcasting from the desired outcomes, such as sustainable healthy diets or nutrition, health, and food security impact, going back to policies and programs that are required to move the system into this direction of healthy diets. And we have seen that this gives room for imagination, and it also enables a constructive dialogue amongst key stakeholders. So our slogan for Better Diets and Nutrition is that diets matter. This is not always agreed upon when we talk about food system transformation. And if you look at the documentation and reports and also the national action plans for food system transformation, you see that there's a lot of attention for agriculture and economy. Agroecology and climate change is now coming into the picture. But if real decisions have to be taken about limited funding, the economy and agriculture is always giving a priority. Yeah, and in our program, we now want to pledge to give also the outcome of healthy diets a priority place besides the other important outcomes. Yeah, and we are confronted with a lot of narratives that are not always very useful in a diet approach. So the first, for example, that economic growth and reduced poverty will reduce malnutrition in the long time. But we all know from evidence that this is not a guarantee for better nutritional outcomes. And it can even lead to overconsumption and overweight or obesity. And there are many examples, like in Mexico, Brazil, and South Africa, that is showing that actually the other side, so the overnutrition, is rising very quickly. So also closing the yield gap. I mean, if we go to the other side on sustainable farming, I'm almost sure that they will talk about closing the yield gap. But we should take care that we shouldn't fuel this yield gap closing only on a few staple foods to produce more calories, and to stimulate the economy, which could affect the diversity of nutritious food or biodiversity and affect the affordability of consumers. Then another narrative which is used very often, and I've heard it before, is cereals provide most of the nutrients, so we need to produce more. And yes, indeed, many diets of African and Asian population are often unbalanced in the sense that they have too many calories derived from cheap staple foods, leaving too little space for valuable foods that deliver other essential nutrients. So it's important to recognize that staples and other cereal crops are also not the best sources of bioavailable iron, zinc, and high-quality proteins, and that we need biofortified crop, or even a small amount of animal source crop that can easily fill these gaps. Another very often heard narrative is that consumers demand what is best for them. We are all consumers, and I think we know already that we are not demanding what is best for us. Often demand is created. And lastly, also the protein transition. As I said, we as nutritionists went to different paradigms. We already know that focusing on one single nutrient will not help for malnutrition. And it doesn't do justice to the complexity of the problems in diets that we have. So what is then a healthy diet? So a healthy diet, and we just got the definition of FAO and WHO in the last year, is a healthy diet should be adequate, should be balanced, should be moderate, and should be diverse. So do we have to worry about our diets? And yes, we do. Yeah, because for many populations, as said already, too much energy is actually coming from nutrient-poor staples. Or many populations do have an unbalanced intake of animal-sourced food or aquatic food. Some of populations are eating too much, but there are also populations that are actually eating too little. So there's too little fruits and vegetables consumed. And many people also do not consume enough nuts, seeds, and legumes, which are an important part of healthy diets. And on top of that, you see a rapidly rising consumption of sugar-sweetened beverages and foods that are high in salt, sugar, and fat. And knowing that the diets that people are eating now, we know that unhealthy diets, or that many people cannot afford healthy diets. For many people, the foods that belong to a healthy diet are not accessible. They're not available, they are not desirable, and often they are not safe enough. And people do not have the agency to choose what they actually want to consume. And on top of that, we know that many populations are eating diets that have a large environmental footprint. And combined with climate change and vulnerability, natural resource degradation, urbanization, conflict, economic shocks, we have to try to find solutions that are win-win. But it's very difficult to find solutions that are win-win. So we have to discuss and find out what the trade-offs are in finding solutions for all these problems. Now I would like to explain you how in Better Diets and Nutrition we like to solve or find solutions for these problems. So we have 6 areas of work, so-called areas of work. The first area of work is zooming into consumers and their food environment. The food environment being the space where the consumer, or where we as consumers meet the supply system and where we make our choices for our food. And then using a food system approach, starting from national action plans for food system transformation as a follow-up of the UNFSS, we are trying to find solutions to get consumers and food environments higher on the agenda and being discussed, and having evidence for solutions that could be taken up in the national action plans as game changers for food system transformation. So we use different leverage points. So the first leverage point is then through consumer and food environment emphasis. The second leverage point we would like to use is focusing on market systems and looking at solutions in market systems to remove barriers for those that are selling nutritious and safe and diverse food to the consumers. And that is using a market system approach, also answering to the national action plans on food system transformation. So in this area of work, we are zooming in especially on micro, small and medium enterprises, as most of the low and middle income populations we are looking at are getting their food from these enterprises. In area of work 3, we are using the leverage points of focusing on specific food groups. And we have chosen these food groups because either it's a kind of general fact that population do not eat sufficient, or foods that are highly contested. So one of these food groups are fruits and vegetables. So area of work 3 is focusing on perishable foods, fruits and vegetables, and is looking at the whole value chain from production towards consumption to see how the intake of fruits and vegetables within a whole diet approach can be improved. Area of work 3 is also looking at animal sourced food and aquatic foods. Yeah, which is highly contested because in the protein transition, it's often said that we should move to a plant-based diet. But we know the populations that we are focusing on do need probably to eat a little bit more animal-sourced food and aquatic foods to fulfill the adequacy component of healthy diets. This has an environmental health price tag. And could contribute to climate change. So this trade-off should be discussed and studied, and making sure that those populations that need more animal-sourced food and have a higher environmental footprint is compensated for example, by us. The fourth area of work is zooming into biofortification and health-enhancing staple foods. Because in some populations, for example, the studies we do in Ethiopia, it appears that with the existing foods, we will not be able to form a desirable and available and affordable healthy diets that has enough adequate nutrients. For example, they are missing calcium and they are missing vitamin B12. So in that case, it would be very good to have biofortified foods ready to fill that particular gap. So then it will be part of a healthy diet. So it's not or, it's a combination of different solutions that we need to implement in specific settings to ensure that a healthy diet can be consumed. As I said earlier, healthy diets is not enough. We need to have a large coverage. Plus, we need to combine it with other systems solutions to ensure that a healthy diet will indeed translate towards better nutrition status. And we think about social safety programs, school feeding, for example, also combinations with water, health and sanitation. So to combine our knowledge for healthy diets in this more larger multi-system and multi-sectoral projects. That is done in area of work 5. Then area of work 6 is actually our all-compassing area of work, where we will strengthen the integration of diet and nutrition-oriented designs within the CGIAR, where we will collaborate with many other science programs, but where we will also disseminate our insights through beyond the targeted countries we work, through regional and global networks. And we would like to build leadership on nutrition and better diets and nutrition for transformative leadership. So I would like you to get a better knowledge on what is done in these areas of work in better diets and nutrition by meeting the scientists that are actually doing work in the areas of work. So for area of work 1, the interim leads are Gina Kennedy, who is here. Maybe you can raise your hand. Mark Lundy, who is not with us, and myself. Area of work 2 is Ellen de Brouw, yes, and Christine Chegge, thanks. Area of work 3 is Diana Olney, who cannot be with us, and Neha Kumar, and Mathieu Ayanan, but I don't think he is here as well, from World Fetch. And area of work 4 is Mercy Luhano and Melanie Connor. You're seated there. Area of work 5 is Jeff Leroy and Neha Kumar. And then area of work 6, we have 3 co-leads with it, Namaku Lokovic, Gina Kennedy, and Neha Kumar. So I hand over to you, Esha, to explain the next steps in the next session.
Thank you so much, Inge. So we have done our work, and now we will make you work. So in the next 45 to 50 minutes, what we will do, that we will have 2 areas of work presenting simultaneously in this room, one in that corner and one here in center. You are free to choose any of the area of work, either 1 or 2. In the second round, we'll have 3 and 4, and in the third round, we'll have 5 and 6. So you're free to go to any area of work, whichever you like, whichever you feel with the title you are more intrigued to. And then there will be the leaders, the scientists of the area of work will make a 5-minute presentation. And after that, you are free to ask questions, you are free to give suggestions. As I said in the beginning, the idea is to gain insights from you to make this program more sharper in terms of the implementation, in terms of the ideas, in terms of the theory of change. So we'll start with the first 2 areas of work. The consumer and food environment area of work will be in that corner. You can see there's a poster there. And the area of work 2 on market systems will be here, right here in the center. So whichever area of work that you want to go, please go towards that. I request the leaders and scientists of the area of work to kindly stand next to your posters. And then after 15 minutes of the presentation and the discussion, we will change. You will then also again have an option to choose between the other 2 areas of work. So let's start with the first and second area of work. Gina, to that corner, and Alan here. You're free to move, free to choose whichever area of work you want to listen to. 15 minutes, and then we'll change and go to area of work 3 and 4. I also encourage our panelists for the next session to kindly go to the areas of work, because then you'll be able to understand better our Better Diets and Nutrition Science program. Consumers towards the door, market systems in the center.
I think we can walk around. Yeah. All right. Okay. So I'm gonna describe. So basically, what I want to discuss is broad competencies that we work on. I think the triangle of support system. So
5 more minutes.
Yeah, and this is clear about quality, multidimensional. It can incorporate nutrition, incorporate sustainability labeling, which is where we have to on the process. We can think of design, appearance. There are lots of quality. Change it better as we have projects. Going on about loss of weight, but not a lot of do. So we're going to try testing and experimenting with ways of trying to reduce loss and work with people about this. And if you have ideas, just let us know. But I'm talking to somebody tomorrow. Market day. So there are some issues like that, but talk to her about
Time up for area of work 1 and 2. Can we request area of work 3 to come here at the center and area of work 4 on biofortified to go near the door? Thank you. And if you still have questions left, please, our scientists and leaders for the different areas of work, you can go and talk to them separately. In the center here, area of work 3, and at the door, area of work 4 on biofortifications. For our online audience, we will be back with the panel discussion at 5:20 CET time. So please bear with us. Thank you. End-to-end solutions for increasing intake of perishable nutrient-rich food here at the center, and biofortified and health-enhancing staples towards the door. Neha, are you there in the room? No, yeah. Okay, so we have our scientist here. At the center, end-to-end solution for perishable foods, and towards the door, biofortified enhancing staples. You have 15 minutes. 5 more minutes.
Yeah.
Last 1 minute. Okay, thank you, area of work 3 and 4. Can we please have area of work 5, multi-sectoral system here in the center, and area of work 6, transformative leadership near the door? Please catch the leaders and scientists if you have more questions. This is the last round of the World Cafe, and after this, we will go back to the panel discussion in the plenary format. So multi-sectoral system in the center and transformative leadership at the door. You have 15 minutes.
Excuse me, could we ask your discussion leaders to wrap up in the next minute or so? Thank you. I am very sorry. We're going to reassemble now in a large meeting. I promise the next session will be equally interesting. Please do come back and take your seats. So let's give a big round of applause to all the action of area work leaders. And thank you so much to all of you for your inputs into these important programs. Come on, round of applause. All right, my name is Charlotte Hebebrand. I'm the Director of Communications and Public Affairs at IFPRI, and it's my pleasure to moderate this next panel. We're going to be hearing from some really important partners of the Better Diets and Nutrition science program. And we have one partner that is a research partner, and that is Dr. Dao Tehan from the Vietnam Academy of Agricultural Sciences. Can I ask you to join us up here, Mr. Dao? An important partner on the research side. We also have a scaling partner with us. So I would also like to invite Sally Atanga Nindeng up on the dais, please. Sally is working in a sister program of the new research portfolio on scaling, the scaling program. So there's a lot of interesting interlinkages with this science program. And then last but not least, we have a funding partner with us as well. So I would like to invite Charlotte Bailey from the FCDO to also come and take a seat on the panel. We should have an implementer partner as well, but we'll try for that for the next time. And while we all get settled, I have another recommendation that maybe the next CGIAR Science Week should be a nutrition week, because I think there are so many, I just loved watching all of the discussions in these smaller groups, and I hope to also get some comments and questions in from you for this panel. So without further ado, I'm going to start with you, Dr. Tao. Vietnam is one of the 18 countries that is included in this science program. So could you talk very briefly about the major nutrition challenges that you have in Vietnam and how you believe that this science program can actually maybe help move the needle on those?
Thank you. First of all, we'd like to thank CGIAR and partner already include Vietnam in this science program. And I think that you know that Vietnam is exportation of agricultural and food. We export also a lot of rice to Africa also. The problem is that we can see that with growing exportation, the malnutrition is still always persists. That means we need action in the food system for resolve the problem. It's not automatically we produce more. The malnutrition will be resolved. So we can see that we are facing the triple burden malnutrition problem. Is that undernutrition in the mountainous area, in the remote area for children under 5. Also the deficiency of micronutrient because we eat more and more industrial and ultra-processed food. And in the city, even we have a lot of food availability, but the obesity is, among the young people and women is increasing relatively fast. That means we need the action. So the question of malnutrition, so the science program, I think that it's very important to give our policy on food system formation. First is the evidence. We have the diagnosis and with the food system approach, and we can see where is the gap, the mismatch in the food system. And you know that food system is environment is multi-ministerial, and a little bit in the health, in the trade, and in the agriculture and environment. So nobody taking the main responsibility. So I think that this is the effort for coordination, and I think that the research can provide a solution for effort on coordination across the ministerial and also how to end up good environment for private sector. And I think that this is really important. Secondly, we think that for the food system transformation, because I am also the national food system convener, the communication, raising awareness for the whole society, stakeholder, consumer, producer, but also policy maker is really important. And we need the good evidence to do this. What is healthy food? What is nutritious food, etc. So this is very important, and this seems very new conception for the business in the country. So thank you for the continuing research and also contribute in the national action plan on food system in Vietnam. Thank you.
Thank you very much. That's really great. And we are so pleased to have the Vietnam Academy of Agricultural Sciences be such an important partner in this program. So thank you very much, Dr. Dao. We're now going to move on to our next panelist. Sali Atangan Ndeng is with Africa Rice, but importantly for this purpose of our discussion today, he plays an important role in the scaling program, which is part of this research, the new research portfolio that's being rolled out this week. So Sali, in your role within the Scaling for Impact program, could you talk a little bit about how you envisage some of the nutrition-related work, how you might partner with the program on better diets and nutrition?
Thank you very much. Thank you, and for inviting me to this panel and to the entire Better Diet for Nutrition family. Thank you very much. Absolutely, we need to really work together if we have to create an impact. This is not just for the Breeding for Better Diets for Nutrition program, but for all the programs. And first, we need to, first of all, align our shared goals. What do we want to achieve? it's very important. You know, the Scaling for Impact program is really about scaling innovations, while the Better Diet and Nutrition program is on adapting and developing better diet innovations. So there is a need for us to identify those critical innovations that can make a change. And we need to do that together. So this is the first thing I will talk about: the biofortified crops, the nutrient-sensitive value chains, the consumer behavior change strategies which are ready for scale or near ready for scale. We need to identify those together. And the second will be really to co-design the strategies. You know, we want to work with you to co-design the strategies, identify the priority geographies together, and also the target populations together, so that we can work in developing, working to see what are the consumer preferences in those environments, the dietary gaps, and the enabling environment that we need to work in for, so that we can ensure that our innovations or what we're doing is gender sensitive as well as youth responsive. And the third is really, for us, we want to really support you to leverage the tools that the Scaling for Impact program will be developing. These tools include the Scaling Readiness Framework that we are developing or have developed, the different innovation packages and bundling approaches, the public-private partnership models that we have worked on and we're setting up, and as well as the business models that we have developed for scaling such innovations. The fourth will really be to, how do we collaborate because we have different stakeholders here. You know, the better diet nutrition stakeholders are mostly those in nutrition and public health. We are at the program level for Scaling for Impact. We may be looking mostly at agriculture and development implementers. So we need to have some kind of a platform or multi-stakeholder platform to ensure that, you know, we can talk to the same partners, the same people, and change and improve both the nutrition outcomes, embed in those platforms, the nutrition notion in those platforms, the food system policies in those platforms, the private sector investments in those platforms, as well as the community practice, you know, because these platforms exist in the community, so we must be there together. Another point I want to talk about is really measuring, monitoring, and evaluation and impact of what we're doing. We need to do this together, have a similar framework embedded in our framework, or your framework needs to embed in our framework, so that we can really monitor most of these things together. And finally, it's about joint capacity sharing, joint learning, and leveraging all this together. So the word I would really say here is, we need to work together, you know, from the beginning. Don't say you want to bring us later. No, from now. So we are ready to work with you and start the scaling process right now. Thank you.
That's great, Sally. Maybe I'm not going to ask you this question now, but I'll come back to you, because I think you just put your hand on something very important, right? In the scaling program, I think you said that people there have more of a focus perhaps on agriculture. So what do you think might be the biggest barriers to scaling from solutions coming out of better diets and nutrition? But we'll come back to that in a second. I want to turn now to my namesake, Charlotte Bailey, who's an advisor with the Food and Agriculture Research Team, FCDO. And Charlotte, maybe you could talk to us a little bit about big picture, right? So what are FCDO's priorities in the realm of diets and nutrition? And do you feel like those are more or less, are those shared by other funders of this work? And then maybe I can ask a follow-on question already. We have alluded during the Science Week to the significant reductions we're seeing in development assistance. So maybe you can also speak a little bit about, you know, in that context, what is your advice to the nutrition community about keeping this really important focus on diets and nutrition?
Thank you for the introduction and the invitation to come and sit on this panel. Nutrition has been for a significant period of time a really key area of work for FCDO, particularly from the research and development perspective. And especially over the last 10 to 15 years, we've done really targeted investment through the CGIAR and through other partners on nutrition research and evidence. And we've seen really instrumental change during that period of time around what has been built around evidence generation. And so I think that whilst we are obviously here to talk about what needs to be done. I think there's also a really useful point of reflection on and celebration, I guess, on kind of what has been done so far and sort of where the field has come. There's obviously lots of questions for the UK at the moment around the cuts to the official development assistance, and there's not much I can say specifically because we are still reiterating our priorities, and so we will know more in the coming months. But I think that in this kind of new environment, there's a lot that is similar in the discussions that we are having in FCDO with other donors, and I think that a lot of this sort of sits across food systems, but as well as in nutrition, is trying to focus on what are the really key biggest challenges globally for tackling malnutrition, and trying to figure out what are those key entry areas where we can make the biggest gains through research and evidence, and then where are the key geographies to be doing that. Geographies have already been mentioned in some of the presentations, and it's sort of something that is continuously coming out in donor conversations as well. So then I think a thing for the Better Diets and Nutrition program would be kind of to be really clear on where the key areas and the key challenges are and how that links to the geography. And then looking at what a cohesive portfolio of work around that is. And this is a great example of that kind of program. But these are the kind of conversations that are coming out in the donor community. I think other key priorities are trying to do more mainstreaming of other areas of impact. So the 5 CGIAR impact areas are really great for FCDO, particularly climate and gender would be really key to be bringing out within the nutrition program. And I think this has kind of a dual benefit because I think it is a really underserved area of research, but it also provides a really good hook for why the nutrition program matters, given these ever-changing sort of circumstances in the landscape. And the sort of last thing around priorities that I wanted to mention was around nutrition integration and making sure that nutrition is integrated across programming. And we are doing this from an FCDO perspective, but it's also something that we're looking to be done across the CGIAR. Our Minister for Development launched the Global Compact on Nutrition Integration at Nutrition for Growth in March. And so we are doing a lot of thinking at the moment, not just on how we can do really intentional nutrition-focused research, but also how we can be integrating it better. And if you want me to come onto the kind of the key things that I think partners should be doing in terms of making sure nutrition is a priority, I think the key thing for me and for FCDO is having really, really clear impact stories and being able to tell the story of why nutrition matters. Because doing this really helps us to showcase and advocate. It helps you to do it for yourself, but it also helps us to do it for our senior leaders and our ministers. And so I think having these really clear impact stories is crucial when we're going through this period of change. And I think the key thing for me is being able to have impact stories that aren't expected to be sort of absorbed by a technical audience. And when you're developing impact stories, really trying to think about putting yourself in the shoes of the person that you are trying to influence, which I think isn't done effectively in the research and evidence space sometimes. And if I could use kind of 2 examples that we use a lot in FCDO about kind of how you can have impact examples that are really tangible and have a really clear sort of end-to-end impact story. So the 2 that I'd like to talk about, one is the vitamin A sweet potato, which we absolutely love as an impact story in FCDO. We're very known as a team for sort of advocating about the sweet potato because it's such a great example of this end-to-end development, from the work in the CG going from the initial development of this vitamin A biofortified sweet potato all the way to how it's being now used in humanitarian contexts in sweet potato puree to feed people who are in crisis. And so it's a really great example in that way, but it's also really, really tangible. I don't know if anyone else noticed on Monday at lunchtime that they were serving the vitamin A biofortified sweet potato in one of the meals, and there was someone there who had a sweet potato cut in half, and you were looking at the cross section and you could see the orange and the purple in one of the others. We've basically done that with ministers. We have taken them sweet potatoes and shown them and given them this very, very tangible thing. And it's really helped understand biofortification, which is actually quite a sort of a challenging concept if you're working across multiple different areas and you're not an expert in something. The other kind of example that I wanted to bring was more on the policy side and kind of some work around food affordability that we've co-funded with the Gates Foundation around food prices for nutrition. And the Food Prices for Nutrition project basically created the cost and affordability of a healthy diet metric. And this metric was then supported by the Food Prices for Nutrition project and was implemented in the government of Nigeria, who then started using it in their monthly bulletins to look at what the affordability of food in Nigeria was. And the inclusion of this metric leveraged the information around affordability and led in part to the uplift in minimum wage in Nigeria last year. So the minimum wage in Nigeria doubled last year. And those two examples are really tangible things that don't require you to have a technical audience to understand why they matter. And I think that's a really key thing when we're in this world of change, being able to really clearly demonstrate why nutrition matters, why nutritious food systems matter, and kind of what the CGIAR or any of our partners' impact is in that area. Thank you.
Okay, that's a lot of really interesting and good comments. And I think I'm sure that Inga is going to maybe respond to some of that in her closing remarks. But my key takeaways are, yes, the funding is going to change, but nutrition obviously remains a priority. So the advice seems to be to focus on some core essential topics and to really tell why these things matter in clear language and to show some impact of previous solutions. So I think that's all, and those examples were great. So thank you so much, Charlotte. Sally, coming back to you, what do you think might be the biggest barrier to scaling some of the nutrition solutions that are going to be coming out of BDN?
Thank you. I see 3 or 4 major barriers. There are many, but I want to point out just 3 or 4 of them. The first is that, nutritious foods it's really invisible. People don't see it. And sometimes it's difficult for us to convince someone that this is nutritious or this is not nutritious. And so the first barrier for us to do, first thing for us to do is how do we really make sure that what we call nutritious food is clearly articulated to the population. So, and that's a big barrier. I have worked on rice. We have produced low glycemic rice, okay? And until one person got, had problems, that had a coma because he ate something which was not high glycemic, then he rushed to look for that rice. Okay, so it's very difficult. This is one of the issues. So even though the technology is there, it's good, sweet potato, these orange sweet potatoes are there, but how many people are planting them? So this is the first thing. So again, we need to look at that very well. Then there's a lack of integration across sectors. So you can see the agriculture, the health, the education, everyone is working in their silos, the private sector. How do we integrate these people into one have a common objective? It's key. And so making this happen is a big challenge because everyone wants to protect their area of interest. And the other one is really weak market incentives for nutritious foods. You can spend time, and Dr. Mati Demon is there, who's my colleague. We have worked on parboiling. It's a lot of work to do parboiling. And then the incentive that people get is very small. So you see that making nutritious food is not easy. So how would you convince an investor to invest in such very small margins? Even though the health benefits are quite enormous. So this is a big challenge. And I don't know how we overcome this. Maybe we need to get some programs that fund this and give some incentives to people to buy food. That is nutritious. And I will not talk about lack of innovation, scaling, readiness. I would rather talk about contextual complexity. It's complex. You can have a very healthy diet which is working here in one community. Don't just think you can take that to another environment and it will work the same, because people have preferences, cultural barriers, their norms, and so on. So there's a lot of difficulties. For example, we have been able to introduce improved parboiling in the northern part and central regions of West Africa across, but getting it in southern parts of Africa where they're close to the port is very, very difficult. Why? Because they are already used to eating non-parboiled rice. So these are some of the things that we need to overcome. It's complex, but I think working together, we can really can break those barriers. Thank you.
Excellent response. I'm glad to see that we have an area of work on multi-sectoral programs, which hopefully will try to look at the connection with the health and the education sector. So really great points. Dr. Dow, I just want to come back to you and I'm sorry, this was not a prepared question, but what did you hear today that got you the most excited? And then I want to just briefly, if we have time, Esha, take a few questions from the floor for our really amazing panel.
So I think that this design of BDN program, I think that is comparing to the previous activities of the SHIFT in Vietnam, I think that is already much more comprehensive and integrated. Because, for example, in the past, we don't see the question of food safety. But after the research in Vietnam, we can see the priority of reaction of different stakeholders about the food safety question is also very important. So you are already integrated. That means the design is already based on the evidence, the previous research. So I'd like to and secondly, I think that the question of the food environment policy, and I think that this is maybe for Vietnam is very, very important because we can say that in Vietnam for food security policy we have 3 periods different. First one we encourage agriculture to produce more food for more quantity, and now we already export a lot. And secondly, due to very high intensification, we put priority on food safety because too much chemical residues, etc., in the food. And now this is a stage of the food and nutrition securities. That so I think that for this area, the more challenge is that, and we hope that we can cooperate with BDN in the future program for food system on how to also to design, to propose a solution, institutional solution for the cross-ministerial food environment enabling for people. And I think that we are very interesting to do this. And also we think that each country, and even one country very diverse like Vietnam, we have a lot of regional food preference. So I think that the challenge of adaptation of this general food and nutrition security to different area and different region is also very challenges that we hope that you can contribute to our food system national action plan. And also the leadership is also leadership area is also very important for not only for working in Vietnam, but also for sharing the experience with the region. And maybe we think that why not can have some exchange between Asian country and African country for the experience of food system transformation. Thank you.
Great. That's a good point on South-South coordination on some of these important topics. So the floor is open. I think we have time for maybe 3 questions. Anybody would like to, yes, please identify yourself. And then if you want to direct your question to somebody on the panel, please do. And I don't know, Inge, maybe some questions will come for you as well.
Thank you. I am Jeff from Food for Security and Peace and Nutrition in Africa. My question will be for Dr. Sally, for example, we are making improvements in, for example, rice, improvement varieties, but the economy is growing, but consumption is a problem. For example, in local counties in Kenya, you find people are more into the economic value, but there is poor food security in the same households. They take everything to the market. How do we encourage so that we have food security in the same households? Thank you.
Thanks. Let's take a few more questions. Yes, please.
Thank you. My name is Crispus from the Institute for Food Justice and Development. My question, I'll direct it to Dr. Inge, and this is about the neglect around clinical nutrition. So a lot of interventions in nutrition look at malnutrition, of course, but we tend to neglect clinical nutrition at the hospitals. And yet this is one of the most serious areas that are in need. If you go to many public hospitals, the food is really bad, nutrition is neglected, patients die every day because of that kind of neglect. What is CGIAR doing around this issue? Because I never see any kind of efforts towards improving or actually a conversation around this. Thank you.
Very interesting question. Do we have one last question from the audience? No? Okay, so let's start with you, Sally. How do we address this issue of poor farming households who have to sell everything they produce? What do we do for nutrition in those instances?
So if farming households are selling all their food, it means they have more value for the money than for the food. Okay, so in that case, what we want to do is to really increase production at the household level. Yields should be increased, we diversify as well. So in Africa Rice Center, what we are doing is we are first of all working to increase the yield and the quality. And at the next stage, we are trying to diversify rice-based systems, making sure that we can grow rice alongside other crops. And we have done that successfully, okay, with vegetables and legumes, as well as integrating rice and fish systems. We have a very big program in Liberia where we have expanded rice fish systems, okay, in that country. And we think that in doing so, you see, because the farmer is having some inputs, he's putting some input on the output. In that case, when they're selling everything, it means the output are less than input. So if they have a single land, a small piece of land, and where they can invest, the inputs go in and they have several outputs, then they can really solve a lot of nutritional issues at the household level. Thank you.
So Inge, your science program is going to have a focus on school meals. Should you also look at hospital meals?
Thank you very much. I think we have to look at the comparative advantage of the CGIAR. I don't think the CGIAR has comparative advantage in clinical nutrition. And as I try to explain, is we are focusing on a healthy diet, which is mainly focusing on preventing disease to happen. I think children that are severely malnourished need treatment. They are sick. So in that case, it's the health system actually that has a better comparative advantage than the CGIAR to cure children that are sick. So in that perspective, the CGIAR has not a lot to offer for hospitals, only to supply or to make sure that healthy food is supplied to hospitals. So I think clinical nutrition is outside of our, I said it already, our comparative advantage. I think there are other groups within the health system that are much better prepared or have experience to address this very important issue. Having said that, in the CGIAR or at IFPRI, there are certain programs that are looking at severely wasted children. And maybe, Jeff, you would like to talk a little bit about that, because that is looking into when a child is sick already, what can be done. But we have to warn you that it really becomes then work within the health system. And that's exactly what we will do in area of work 5, to see how do these different systems actually link or can support each other with certain problems in malnutrition. Jeff, I take you on the spot. Maybe you can say a little bit of the work that you're doing with wasting.
Yeah, so very briefly, because I think we're running out of time, but and happy to chat afterwards. But at IFPRI, we do have research on that looks at how we can improve the prevalence of screening. Acute malnutrition is acute, and it's very important that you identify the children in time so you can start them on a treatment course, which is very effective. But the big challenge is finding the children, and the second big challenge is continuing the treatment until the child has recovered. So we have done quite a few studies that have looked at both those aspects, diagnosing and screening, and then also the treatment part. But I fully agree with Inge, that's more than anything, a health sector responsibility.
Great. Please join me in thanking our 3 very excellent panelists. Thank you so much. And now it's my pleasure to invite the CGIAR Managing Director to the dais. She's going to give us her comments on this science program. And after Ismahan El-Wafi speaks to us, Inge is going to come back up here and give you some closing remarks on what's been a really, really rich discussion. Welcome, Ismahan. No, I think we hear from you first. Thank you so much.
Thank you so much, Charlotte. Good afternoon, everybody. As we come to the end of today's discussion, I want just to extend my sincere thanks to every one of you for your engagement and your insight as well. I think really I'm very happy to see the launch of the Better Diet and Nutrition Science Program as part and parcel, and very, very important at the heart of the CGIAR portfolio for 2025 to 2030. I think this is a very important step in our mission to transform land, food, and water system. And it is a loud call for action for all of us committed to this transformation. Throughout today's dialogue, we have explored the critical challenges that persist in ensuring healthy diet for all. We have to remember that we have still 3 billion people that cannot afford and do not have access to nutritious, affordable food, and malnutrition continues to threaten lives across the globe. But what stands out from the discussion is that here you talked beyond availability, is that we have also a crisis in terms of affordability, in terms of accessibility, and most importantly, in the sense of equity, that many people are not having the same ability or have the same chances to access that food. The insight shared today reinforced the need for a systemic approach that looks beyond food production to address the policies, the markets, and consumer behavior that shape dietary choices. The CGIAR Better Diet and Nutrition Science Program is designed to do exactly that, to co-create solutions with national partners, to engage communities, and provide the evidence needed to reshape food environment for the better. And the policy side is very important. I always say only private sectors have understood the importance of policy. And that's why they are lobbying so well in all capitals. And they use the policy the right way. Us as scientists haven't got it yet fully. And most of the time, we don't have the means to do it as well. Lobbying, it's a costly exercise, particularly in the environment where we are. So I think we can all agree that a key takeaway from today, it's realizing the power of collaboration. Government, researchers, market actors, and local communities all have a role to play in making sustainable, healthy diets not just an aspiration, but a reality. Innovation, capacity building, and policy change must work hand in hand to ensure that nutritious food is desirable, accessible, and affordable for all. Today's discussion is only the beginning of CGIAR commitment. This program is about long-term impact and about equipping countries with knowledge, tools, and support they need to drive meaningful change. And we are not starting from scratch. We have done it for many years, but what we recognize, all of us, is that we have to accelerate. We can't keep going at the same pace. Otherwise, we're going to be really far behind by 2030 and beyond. We know that real transformation requires ongoing action, so let's take what we have discussed here and turn it into concrete steps that will shape the future of global nutrition. Thank you all for your dedication. Thank you for your expertise and vision in bringing this program to life. And just to end up on the lobbying, the way the private sector does it is different, but we can use people, we can use communities, we can use the voice of youth and the voice of people that will make it to politician and get us to get affordable food for all. The work ahead is complex, but together we can build food system that works for everyone. Let's move forward with urgency, with prioritizing partnership and collaboration, and with the shared goal of ensuring that everyone, everywhere, has access to a healthier food and healthier future. Thank you so much.
Inge, will you come join us?
Mm-hmm. Yeah, I almost wanted to say there's nothing I should add here. Thank you very much for your finding, your last words concerning our better diets and nutrition. I would also like to thank all for your input. I've been, with the different sessions in the corners of this room, and the discussions were very lively, very good questions were asked, and they are noted, and we will take them along, definitely. And I'm really happy that you also met our scientists and our researchers in the different areas of work. To make a little bit of advertisement, this evening at 6:30, there is another session on biofortified and health-enhancing crops and products. It's in CR8, and Melanie and Mercy already left, I think. Oh, you're still there. They will definitely be involved. And then on 11th of April in the morning, we will have a session which is related to area of work 6. And there we are seeking, to develop a collaboration group of different science programs or people that would like to link with better diets and nutrition to form a working group. So that's also reacting then to your comment, Charlotte, on that in the end-to-end approach, we actually have to collaborate. And it's not collaborating end-to-end, but I think it's also collaborating within science programs because, and I think if you leave this room and you remember only one slogan, I would be very happy. Diets matter. So I would like to ask you, when you have your dinner tonight, look at your plate. What is on the plate? And think about where it's actually coming from. And which science programs here actually played a role in getting the food on your plate. You also asked that healthy diets or the consequences are invisible. And I would like to remind you that in now many countries, we have dietary guidelines. And with the dietary guidelines, we often have nice pictures that are actually showing what a healthy food is. And I think that makes it visible. So if you look at your plate, look at the healthy dietary guidelines and decide yourself, are you eating healthy or can it be better? I know for sure my diet can be better. So yeah, working together is extremely important. What I took from Dao's remarks is the leadership area. And we are working now in Vietnam for quite some time. But what I see happening is that Vietnam is actually now becoming an example for other countries. So there are many countries that are visiting Vietnam now to look at what they are doing in food system transformation, and also take along the message, that a healthy diet or a sustainable healthy diet is an important outcome of food system transformation alongside the other outcomes. And yes, better diets and nutrition is not working on production. Not saying that production is not important. The expertise on production is in other science programs, which means that we have to collaborate very closely with these programs. So with Breeding for Tomorrow, with SAF, for example, and we are starting up these collaborations already. But in our Better Diets and Nutrition program, we are highlighting the other side of the coin, which is the consumers and the food environments that are actually showing the last mile to your plate. Or actually, we say it is the first mile of the plate. So I would like to thank you for your inputs, for your discussion points and questions. And we hope to be able to continue these discussions. Probably there will be a Science Week again in a few years. And then we can show what results we actually have in collaboration with you. So on the screen, you see a QR code. This is a Google form where you can leave behind your remarks, comments, questions, or suggestions. And we will definitely look very seriously to them. So Charlotte, thanks a lot for your panel discussion, moderating the panel discussion. And Esha, thanks a lot for also introducing all the areas of work leads and co-leads, having a lively explanation of the work in the areas of work. And then behind the screen, we see Amanda Wyatt, who was actually managing the IT, which didn't have a lot of hiccups compared to our first session on Monday morning. So thanks a lot and have a nice dinner. And don't forget, diets matter, and look at the plate what you're eating tonight. Thanks. Oh.
Gitu. Angeline!